Welcome to the McGill University Health Center. With the current COVID situation, the MUHC has put in place measures to ensure a safe presence for loved ones. Before your visit, let's go over some infection control measures that will help you stay safe during your visit and beyond, while also ensuring the safety of other patients and staff. Note that family presence hours are from 9 a.m. to 7 p.m. Most patients are allowed a maximum of 3 family members or caregivers. While Montreal is in an orange zone, a maximum of 2 people can visit each day. You are either the first or second visitor today. If you've been designated by your loved one, you may visit if you are visiting the patient on your own. Patients can have only 1 visitor at a time, unless specified otherwise by your loved one's care team. You do not have any symptoms of a respiratory infection or been exposed to someone with symptoms or someone with a respiratory infection. You have not traveled outside of Canada in the last 14 days. Today, we remind you that it's important to 1. Wash your hands often. Hand washing is important in preventing the spread of COVID-19. Thank you for washing your hands every time you enter and exit the hospital and whenever you go in or out of your loved one's room. Unless you're in contact with biological fluids or if a member of the care team specifies otherwise, gloves should not be worn. Before entering the room, you might see a sign that looks like this. If you do, please refer to staff first before entering. Keep in mind that these posters come in different colors in addition to the ones seen here. 2. Keep your distance. We ask that you stay at least 2 meters away from other people at all possible times. To help give you an idea of what 2 meters looks like, think of the height of a door. 3. Wear a mask. We'll provide you with a new procedure mask upon entry. You won't be able to wear your own mask. You must always wear a mask when you're in the hospital. Make sure that the mask covers your nose and your mouth. Once you have it on, don't touch your mask or your face. If you do touch it, though, be sure to wash your hands after. Your loved one should also wear a mask while you're at the bedside, unless they're unable to. When you remove your mask, be sure to take it off by the straps behind your ears. 4. Limit where you go while in the hospital. We kindly ask that you stay in your loved one's room. If you need help for things such as getting extra blankets or ice or water, let us know by using the call bell in the room. You may leave the room for essential reasons such as buying food, to limit circulation in the hospital, and because family rooms are currently closed, we encourage you to bring your own food. Please note that microwaves and fridges on the units cannot be used. In order to limit circulation, we prefer that you only visit once a day if possible. 5. Minimize the amount of objects you bring. Wearing clean clothes and avoiding to wear jewelry are some ways to reduce the spread of microorganisms. We also encourage you to disinfect your cell phone whenever you enter and exit the hospital. 6. Stay safe between visits. What you do outside the hospital matters just as much as what you do when you're here. In addition to the healthy habits we went over today, make sure that in your personal life you respect public health directives related to, for instance, gatherings, and that you stay away from people who exhibit symptoms of sickness. Some units may have specific directives, such as more restricted hours, or may need to have further restrictions temporarily. We appreciate your patience and collaborations as the guidelines may change over time as the COVID situation evolves. On each visit, you will be asked to sign a log and to declare that you do not have COVID-19 symptoms, or been exposed to someone with COVID-19, or have traveled outside of Canada. Respecting these infection control measures is what allows us to welcome loved ones at the bedside while also ensuring the safety of others. We thank you in advance for your cooperation and thank you for being there for your loved one. We wish you an enjoyable visit. If you have any questions, please don't hesitate to ask the care team. Now let's go over some steps for properly washing your hands.
Appliquez suffisamment de solution de friction des mains hydroalcoolique dans la paume de la main. Frottez les mains ensemble afin d'enduire toutes les surfaces des mains et des doigts. Continuez à frotter toutes les surfaces des mains, y compris les ongles, les pouces et les doigts, jusqu'à ce qu'elles soient complètement sèches.